My name is Suzanne Chisholm, and this is my presentation, Sexual Health is Public Health in Oglala Lakota County. For those unfamiliar with Oglala Lakota County, it is located in the southwest corner of South Dakota and is home to the Oglala Lakota Sioux tribe. It's roughly the size of Rhode Island, and it's about 45 minutes from the Badlands. OLC's participation in the U.S. Census is low, so population data is likely undercounted. The population is primarily younger, with an average age of 27, and the poverty rate is 52.8%. Historically, American Indians have faced significant traumas, including being severed from their connection to the land, banned from their cultural practices, and having their children forcefully removed from their homes and placed into boarding schools. Through colonization and forced assimilation, many traditions were disrupted. In turn, this has led to mistrust and a concept known as historical trauma. This historical trauma is something that affects the health of American Indians today and can be reflected as depression, substance use, and self-harm. Despite centuries of health inequities and trauma, the OLC community is strong in traditions, values, and practices. The central unit of Lakota culture is family and community. Elders are respected, and the children are protected. Storytelling is how history, language, and traditions are preserved. In interactions, prolonged eye contact is seen as a sign of disrespect. Several traditional practices are used for healing and purification, such as participation in a sweat lodge, sundance, and other ceremonies. Additionally, native plants like sage, sweetgrass, bear root, and cedar are used for medicinal purposes and smudging. These Lakota practices and values have many health implications and should be woven into any health promotion effort, as they are linked to a strong sense of cultural identity and serve as a protective factor in health. I want to preface the following data slides with the fact that tribal nations are considered sovereign, meaning they own the right to how their data is collected, used, and shared. Research identifies several recurring themes such as tensions between American Indians and external data systems, racial misclassifications, and low participation in data surveys that contribute to limited, fragmented, inaccurate, and often just unavailable data findings. In health matters, it's important to consider these challenges when analyzing the data. Now, I want to start my population health analysis with healthcare. Research shows that American Indians living on reservations face a significant lack of access to healthcare. The Pine Ridge Indian Reservation is geographically isolated, with one small rural hospital and 3 outlying clinics. Due to the historical trade of land and resources, the U.S. government is obligated under treaties to provide health care for tribal members. This is provided through the Indian Health Service, which is documented to have challenges, including critical staffing and chronic funding shortages that limit their ability to provide consistent and comprehensive services. If a tribal member should need services that are not available through IHS, the next closest hospital is 90 miles away. This, in addition to the fact that American Indians are twice as likely as whites to report transportation barriers, further contributes to the difficulties in healthcare access. This slide also visualizes data on some of the other social and environmental disparities that OLC faces. OLC is known as a food desert, so access to healthy foods is extremely limited. Ultimately, each factor should not be considered in isolation, as they collectively contribute to health status and outcomes. OLC faces alarmingly disproportionate rates of heart disease, diabetes, suicide, and other chronic and infectious diseases. Many of these rates were documented as higher than the state and national averages by double or even triple. So all of this adds up to American Indians having the lowest life expectancy of all racial and ethnic groups. In fact, the last time the national life expectancy was 56 years old was in the 1920s, which is just disheartening. As advanced practice nurses, it's essential to look at the bigger picture with this. It's more than just knowing the numbers, it's looking upstream at what's contributing to them and applying that knowledge in practice to make a difference. As this presentation spotlights STIs, I'm going to pivot now to the data on STIs. STIs are reportable to public health entities. Awareness of STI data is vital to public health efforts, resource allocation, and policy development. However, the transparency of this data is limited, especially at the tribal level. I experienced this firsthand as it took extensive outreach to get the county level data for this presentation. On the right is a list of everyone I contacted over the last few weeks. At the global level, approximately 374 million STIs are reported each year, which translates to more than 1 million STIs per day. Researchers state in the American Journal of Medicine that in 2023, American Indians had the highest rates of primary and secondary syphilis in the nation. South Dakota is rated number 1 for adult and congenital syphilis. Compared to national rates, chlamydia is 5 times higher, gonorrhea is 8 times higher, and adult syphilis is 114 times higher in OLC. While these numbers are significant, it is important to consider that this data could be undercounted because of tribal data sharing barriers, or this data could be overcounted as population data is likely much higher due to low census participation, which would affect the county's STI rates as well. While STIs aren't passed down genetically, genetic variation plays a role in the interaction between the host and the pathogen. Whether the STI is bacterial, viral, or parasitic, it is the host genetics that determines how the immune system responds. Some people have a genetic variation that lowers their immune response, which makes them more susceptible to infections and affects the severity of disease progression. Now, genomics is important as it allows scientists to study the pathogens that cause STIs. Genomic analysis has led to the discovery of new lineages of STIs, such as chlamydia. It also allows for the study of antimicrobial resistance, such as with what's called supergonorrhea, a strain of gonorrhea that has been resistant to ceftriaxone treatment. Ultimately, genomic investigation of STIs provides valuable insights and aids into the development of better control strategies, including guiding treatment decisions and vaccine development. Nursing frameworks are often used to guide public health efforts. This framework is tailored to mitigate STIs and enhance sexual health specifically for tribal communities, so I found it was perfect for guiding the development of my health promotion activity. This framework is like the socio-ecological model as it addresses multiple levels and factors of health from the individual level to the organizational level. Using this framework, my health promotion activity was guided by factors such as social and environmental determinants of health, historical trauma, and protective factors such as Lakota culture and traditions. Also considered were accessibility of nursing services, public health science, disease surveillance, and data sharing. In addition to nursing frameworks, the provision in the American Nurses Association's Code of Ethics provide moral standards for nursing practice. Provision 3 states that the nurse establishes a trusting relationship and advocates for the rights, health, and safety of recipients of nursing care. When addressing sensitive and stigmatized health issues like STIs, ensuring privacy and confidentiality and promoting a culture of safety are of the utmost importance. Discussing sexual health and providing care for STIs can be uncomfortable. While nurses must safeguard medical information, it's equally important to ensure a safe, private physical space and ensure consent during care, regardless of whether that care is provided in person, virtually, or via phone. For example, when I call a patient to inform them of their results, I always start the call by asking if they are in a private place to discuss their lab work. Also, it's important to share that nurses are mandatory reporters, so certain situations like abuse and communicable diseases may involve sharing sensitive information with other agencies. Nurses need to be transparent and honest with patients about this so the nurse-patient relationship is not affected, because having that trust is so important. The findings throughout this project motivated the idea for this health promotion activity. The proposal is to have nurse-managed community health centers within each district on the reservation for a total of 8 centers. These facilities would function much like a small satellite health department, offering a spectrum of services, including multimodal health education, health screenings, vaccination, and nurse-delivered treatment and referrals. This project starts with cultural sensitivity and trauma-informed care training for all staff to practice cultural humility. This involves evidence-based, culturally adapted education for both health center staff and the community. Many programs and resources are listed to aid the nurses in providing this education to the community. The CDC has courses pertaining to STIs, including a framework for taking a sexual history, which is important in contact tracing and disease surveillance. There's also the National STD curriculum, which has on-demand STI clinical reference guides and self-study lessons. These courses provide education valuable to nurses covering topics like STI causes, epidemiology, clinical manifestations, diagnosis, treatment, and prevention. It's also important to ensure that nurses understand their roles, activities, and responsibilities and are trained to provide culturally sensitive and age-appropriate care. This education would include, at minimum, the nursing activities on this slide. STIs are not always straightforward, so teaching nurses where they can go if they get stuck on a complicated case is needed as well, such as the clinical decision support offered through the STI Clinical Consultation Service. And most importantly, nurses should be educated on the importance of collaborative partnerships that respect tribal rights while supporting multi-level data sharing to contribute to the solutions and be able to evaluate and measure progress. As you can see on this slide, there are many different screening options available for syphilis testing. For this presentation, I will be focusing on the point-of-care test known as the Syphilis Health Check. In the chart, you can see that point-of-care testing options have lower sensitivity and specificity than the serologic or lab testing options, so there is a small chance that they can lead to false negatives and false positives. Another disadvantage is that all positive point-of-care tests must be confirmed with lab testing. Point-of-care testing does have many advantages. It provides quick results in as little as 10 minutes. It's easy to perform and collect as the test is done by a finger stick and only requires a small sample. It's ideal for areas of higher incidence or new cases. Point-of-care syphilis testing is most appropriate in rural, resource-limited, and community-based settings. It's also a good option for people who don't regularly access healthcare and those with substance abuse issues, as they allow for quick results and same-day treatment. Point-of-care testing should not be done on people with a known history of syphilis, as they require that lab-based testing. And lastly, point-of-care testing is affordable, as each test runs around $10 in comparison to RPR testing, where initial screening is around $8, and if that's positive, running a tighter level is about $23. STIs have a profound economic burden. The CDC reports that in 2018, the total financial burden of STIs in the U.S. was $16 billion. $174 million of that cost was from syphilis alone. The estimated lifetime cost for syphilis is $1,190 per case. So if we applied that cost to every case in South Dakota for 2023, it would cost the state a little over $800,000 just for primary and secondary syphilis, not even counting the other STIs. On the other hand, the estimated cost to run a nurse-managed community health center is around $756,000 per year. To have one of these centers in each of the 8 districts across the reservation, the total cost would be about $6 million, which would be possible through federal, state, and grant funding. My references are on the next slide, but I'm going to jump to the appendix and briefly discuss the patient education handout. I created the following educational handout with the intent of it being used as a general informational guide regarding the new community health centers. On the reservation, I think social media, Keeley radio station, and word of mouth are the best methods for generating public awareness about these health centers, but these flyers could also be used. Now you can see on the flyer I didn't narrow down the focus to STIs. Many districts on the reservation are small, close-knit communities, and I can't imagine many people would want to be caught going into an STI center. So I made the following flyer as an informative overview of the variety of services available at the facility, which includes STI screening and treatment, but also includes vaccinations, incentivized health education, and more. The flyer also shares that these services are available on-site or as a home visit, which I think greatly improves barriers to access to care and provides a private in-home option for those with any confidentiality concerns. To conclude this presentation, I want to say that I think these nurse-managed community health centers are a promising strategy to address the many public health needs within each district, especially enhancing sexual health and reducing STI rates. I believe they can impact public health more broadly within OLC by supporting the overall health and well-being and advancing health equity through the multi-level framework and culturally appropriate programs and services. If you have any questions, please post them on this forum and I will get back to you. And I want to thank everyone for their time.